So many people are looking to live happier, more stress-free lives. We provide interviews from mental health experts across various fields because we know finding quality information isn't always easy. Let's find more sanity together. On today's episode, Dr. Adam Weissman discusses problems related to access to empirically supported treatments for those in need and how his new foundation is trying to help remedy this. After listening to this podcast, for those interested in joining the Foundation's COVID relief campaign in any way, whether that be time, service, or donations, in the effort to help change the mental health landscape and access to care in our country, go to weissmanchildrensfoundation.org. This link is in our show notes, and I've personally donated to this foundation. Dr. Weissman is the founding president, CEO, and chief psychologist of the Child and Family Institute and Child and Family Institute Academy. He has recently founded the Weissman Children's Foundation, which is a national nonprofit in development dedicated to promoting mental health equity and access to evidence-based psychological treatments for children and families in need. Dr. Weissman has won research and service awards for his work, including the 2020 American Psychological Association Distinguished Contributions to Practice Award, and was recently selected as a 40 under 40 Rising Star for Westchester County, New York, and is a finalist for New York State. His private practice was also honored this year as the top hospital/clinic in the region. He is also the president of the New York State Psychological Association's Cognitive Behavioral Therapy Division and is incoming president of the Westchester County Psychological Association. Now on to the interview. Adam, welcome to Sanity Podcast. Thanks for taking the time.
Thanks so much, Jason. Thanks for having me. What a great opportunity to talk about the state of the mental health field and access to mental health care in our country, and also give some visibility to the COVID mental health relief initiative through the Weissman Children's Foundation. So thanks so much for having me on.
Yeah, absolutely. And for those of you guys that don't know, Adam has done a wonderful thing. And we're going to talk more about it in a second. He created this great foundation to help people that don't have access to evidence-based treatment. We're going to get into that more. But before we go there, a question I ask at the beginning of every episode is, what is your theoretical orientation? What's your approach to therapy? And what does therapy mean to you?
Yeah, great question. I'm a self-identified cognitive behavioral therapist or cognitive behavioral psychologist. I've been fortunate to train with some of the top CBT or cognitive behavioral therapy mentors and supervisors and trainers in the country and in the world to some extent. So that's been a real privilege for me. But I basically, the treatments that I provide to children and that we provide at the Child and Family Institute and the Weissman Children's Foundation are all rooted in cognitive and behavioral science. So they're treatments that have been shown to be efficacious or effective in, nationally renowned, internationally renowned clinics, laboratories, and institutions, training institutions, through rigorously tested randomized control trials and things like that. And now they're being taken out into the real world, like our setting. And we're actually utilizing those treatments with clients with anxiety, depression, behavioral issues, ADHD, habit issues, or tic disorders, things like that. Really, the whole gamut. But all the treatments are tried and tested in research institutions. They've been shown to work, and they're rooted in cognitive and behavioral science.
Okay. And before we jump into how the foundation is going to help this gap in access, I just wanted to start it off. What is this gap in access, just in case people aren't aware of what's going on in our society?
Yeah. This has been a problem that's been plaguing us for a long time, well before COVID. I think that, as you and I both are aware, and a lot of people in the field know, both the federal government and the insurance companies have not done an adequate job of prioritizing coverage for effective mental and behavioral health services. And the sad truth in our country is that if you have $300 to $400 an hour for a private clinical psychologist, practicing evidence-based treatments, that the gold standard treatments that I just talked about a little bit, then that's great. But if you don't have means, then you're likely out of luck at being able to access high quality mental health care in the United States. Actually been over a decade since Congress first passed the Mental Health Parity and Addiction Equity Act, with its initial promise to make mental health treatment just as easy to access as other medical services. Yet, as we know, still today, amid a global pandemic, an economic crisis, an opioid epidemic, and spikes in anxiety, depression, and suicide rates, the vast majority of Americans continue to be denied access to high quality, evidence-based psychological services. And we know that even more devastating is how this is disproportionately true among underserved communities of color. So that's just a little bit of background about what's been going on. And of course, this has been happening for years, well before COVID.
Yeah. So it sounds like you're trying to fill this gap where the insurance companies and the government might not be stepping in as full-heartedly as they should be. Do you have any thoughts? Like, so say that someone from the government or the insurance company were listening. Well, what is your thoughts about how outside of your foundation, how they could be helping this gap in service?
Sure. Yeah, it's a great question, Jason. I might start. I have a few stats on just like this whole kind of mental health insurance debacle that's been happening, and it might shed some light on what's going on now. And then after that, I'd be happy to share some of my personal beliefs about what can or should be done.
Fantastic.
But I will mention that there is a recent study by Milliman, which is a risk management and healthcare consulting company. And they reported that mental and behavioral health services were actually 4 to 6 times more likely to be provided out of network compared to medical or surgical care in the United States. And the study also revealed, this one's really interesting, that in-network mental health providers were paid significantly less, in some states over 50% less, than primary care providers providing similar mental health services.
Interesting.
So what this means to me is that if you're a primary care physician and you're provided mental health services, which you may or may not even be equipped or trained to provide, you're getting paid a lot more than perhaps twice as much as a licensed psychologist or mental health provider who essentially trained their whole graduate career in the provision of mental health services. So that's just astounding to me. As a result of this, because of these low reimbursement rates, the most skilled or specialized, clinical psychologists, mental health clinicians, right, may ultimately be incentivized to work out of network, right, for private pay and avoid in-network insurance contracts altogether. And the same study I mentioned also reported that as high as 63% of mental and behavioral health care may be occurring exclusively out of network in some regions. For example, Washington, D.C., 63%. That's just crazy. And this is resulting in a combination of expensive insurance plans, because people are still paying those expensive premiums, right? Mm-hmm. With insufficient mental and behavioral health networks, coupled with rising costs of expensive private out-of-network mental health services. And together, this is only serving to widen that gap in both mental health access and equity. So that's kind of what's been happening for a long time. And obviously, this has all been exacerbated by COVID and the kind of hidden mental health pandemic that I'm calling it, that's happened since COVID, in the surge in rates of so many mental health issues. But, on a personal note, I believe that comprehensive healthcare, right, including mental health care, is a human right. And as a result, I think a single payer system that compensates evidence-based mental health providers commensurately to other medical specialties could potentially work well. And I want to be clear, I'm not opposed to private options for those who do have means. But I do believe that a basic standard of rigorously tested, empirically supported mental health services should be available to everyone, regardless of the ability to pay. And that essentially is the premise behind the Weissman Children's Foundation.
Yeah. And I think other countries are already doing this, government-wise. Like, I'm pretty sure Dr. Clark out in England is doing some, through the nationalized healthcare, doing CBT therapy and providing online services, and are doing research to show that they're effective. And I'm pretty sure other countries are going there. So it would be really nice to see our country looking and saying, okay, we know that there's some treatments that have evidence that work, and we know that there's treatments that don't. Should we, or don't have evidence that they're effective? Should we be putting more money behind the effectiveness to really help people?
Yeah.
And we both, she works in my private practice, Christine Peters, and you know her as well. And this is a topic that she's very passionate about. And when I was talking to her, she was saying that a lot of the Medicaid clinics are completely overswamped with people that need mental health needs, and there's wait list. So even where there is low cost options in some areas, people still can't even get them.
That's 100% right. So sometimes what people will say, as we'll talk more about the Weissman Children's Foundation in a little bit, but we're trying to create the systemic model for, sustained access and change. And then sometimes someone will say, well, there is this one clinic, in Westchester County or in New York City that does something sort of similar to what you guys are trying to accomplish. What do you think about them? And I say, well, I think it's fantastic, and I would support any nonprofit trying to do the same kinds of like-minded work and dissemination and creating access to underserved populations, effective mental health care. Anyone who's doing that, I'm on board. I will, collaborate and be an ambassador for them, whatever is needed. However, from what I've seen, those programs are usually kind of very specific to a location, serving a single community. And if they are low fee or taking insurance or things like that, of course, some people don't have insurance at all, or pro bono even, there's usually a very, very long wait list. Mm-hmm. And then so what we're receiving sometimes is I tried this program down the road from one of your offices, but they said there's a year wait. Can you help us now? And we're like, yes, we can help you now. So, and then of course the breadth of services that we are able to offer, sometimes more specialties and more specializations than some of these other programs, but there are other programs out there, and they are trying. They're just typically more, constrained to one location and working beyond their bandwidth. And so, what we'd like to do is pull together resources with like-minded folks in the community. We've had more people come out of the woodwork say, how can we help? How can we get involved? I have a private practice. I'd like to do low fee or pro bono work. Can we team up? Individual clinicians coming out saying, hey, I'd like to donate an hour to WCF. How can we work together to create this mission and make it more systemic and sustainable, and actually potentially result in some policy change later on down the road once we collect some data and do some research and things like that. That's where I like this to head versus kind of one-stop kind of shops that are isolated from one another that are trying to tackle this, but not in an integrated way. And so that's we do have some good programs that exist already, but I think the issue is that they're so micro, and I'm thinking about this, as you know me, in a much more macro level way.
Yeah, absolutely. And on the show notes, I'm going to have a link to the foundation so people could donate if they want to donate. But donation, as you were saying, doesn't just have to be money. It could be time. It could be service. One of the means that people could help people is that if you're trained in these empirically supported treatments, you might be able to volunteer in order to help a family, a kid, or somebody that's in need.
Absolutely. 1 hour a week. We have a lot of people who are just reaching out and signing up. Some people who are bilingual, which is great, speaking Spanish as well. Our clinicians of color, are welcome and in high need, high demand. But yeah, anybody who wants to, a lot of people out there, I think are working hard on their practices, obviously trying to build their practices, provide for their family, don't necessarily have the means to be able to time, energy, youth to some extent, to start a whole nonprofit right now. And so that's not what's, I don't think everyone needs to build the same thing, but what some people might be wanting to do is saying, I'm working really hard. I'm helping all these people. I would love to be able to help somebody who's underserved, because I don't have an opportunity to do that right now. Because I'm building my practice and I need to have, billable hours. I need to have an income coming in to pay my bills, but I love to spend 1 hour helping an underserved family for free. And there's probably a lot more people who have the bandwidth for that, than, something, again, on more of a macro level. So it's an amazing way to get involved, and it becomes a partnership if people are looking to do some of that work. So those folks can feel free to reach out, and we're just like so excited to be at this stage, building our team, trying to get people excited about a common mission, engaging one another, and then also collaborating with amazing folks like you, Jason, who are tackling dissemination in a very like-minded way through, in your case, a podcast, through media, and other partners through tech, and so coming at it from different angles and then like kind of working together is really the way to get this done.
Absolutely. And I think that our field has, and not just me, has done a really good job proving that, CBT is effective or other treatments are effective, but maybe didn't spend enough time and money telling people that it was there. So now we're playing a little bit of catch up, that we have stuff that we know really works, and now we have to help people hear that it really works. One thing so I watched your I don't know, award ceremony, your when you gave your speech at the award ceremony, and before I want to talk about the comment in there, you won a fairly prestigious award recently around this work. So what's the award that you just received?
Oh yeah, wow. I was very surprised and caught off guard when I received a notice that I was the awardee of the recipient of the 2020 APA Distinguished Contributions to Practice Award. I was 39 years old for full disclosure when I received this notice, and I said, "How is that possible?" Because there's so many incredible, practitioners in the field who have been doing this a lot longer than me and have done amazing things and also helped underserved populations and things like that. So I was really humbled and honored to receive it. And I think it's a testament to the more kind of systemic work that I think we're trying to do, like thinking outside the box and creating partnerships and pathways to access to care. And, so I think that a lot of that, like building out those dissemination models, was a part of probably why that they thought of me for that. But it's just an incredible award. And I was so incredibly humbled to share that also with my team. We have two organizations, I guess, across Child and Family Institute and the Weissman Children's Foundation, of nearly 100, staff, consultants, and volunteers. And, I'm just one cog in the wheel. So it really is an organization-wide recognition. And I think the idea is it's great that they are giving an award like that to practitioners, not just to researchers. Mm-hmm. And recognizing like, okay, people are actually innovating practice ideas and innovating, service delivery and implementation models, not necessarily just done in the laboratory at, the top institutions, but also out in the real world with underserved communities and such. And so, and in private practice as well. So I love that they have that award. I think it's really cool. I think APA is on the right track with celebrating people who are trying to do that work, in particular the applied work, and hopefully that'll lead to policy change. But that for me, that was a platform that I felt so blessed to be given. And as soon as I received it, I said, well, this is the platform I'm going to use to announce the launch of the Weissman Children's Foundation and our COVID mental health relief initiative, and try to just garner more traction and momentum.
And in your remarks on that, you were talking about, it's just opportune that this foundation started coming out around COVID, because you're talking about how COVID has made the access situation worse. So I was hoping that you could talk a little bit on that.
Yeah, well, one thing I wanted to say maybe earlier in the podcast was I'm big on stats for these types of things. So I was going to say that it feels like every week lately we're hitting some sort of new devastating COVID milestone, right?
Yep.
With I just checked today. So with today, nearly 20 million cases, like very close to 20 million cases, and over 330,000 lives lost in the United States alone. like as of today, right? So obviously the good news is that we're now starting to see our frontline healthcare workers getting the first vaccines, which is great, and definitely giving us some hope for better days ahead. But unfortunately, as you and I both know, there is no vaccine for mental illness, right? And there's actually been a number of studies of late that have been supporting what you and I are seeing clinically, right? And I said this before, but essentially a hidden mental health pandemic. And I'll give you a couple of studies that have just been kind of, supporting the surge in rates, right? And so we have a CDC study that just came out, and it's reporting surges in anxiety, depression, substance use, and suicidal ideation during COVID, and disproportionately so among younger adults and racial and ethnic minorities. And another study from Oxford University has now actually directly linked COVID and mental illness, reporting that those with pre-existing mental health conditions were 65% more likely to be diagnosed with COVID. 65%. That's astounding to me. And that study concluded that mental illness should now be regarded as an important COVID risk factor. And yet another study by Mental Health America, this one's really sad to me, reported that rates of suicidal ideation are actually highest among youth, with over half of 11 to 17-year-olds reporting having thoughts of suicide or self-harm, more than half or nearly every day of the previous 2 weeks. So clearly the situation in our country for children and families, during COVID is extremely dire. So that's where we're at.
Absolutely. And these rates are skyrocketing and people don't have access. And it sounds like, and I'm not sure, I remember hearing that stat. I didn't look at that article directly. Did they have a cause and effect of why people with mental illness were 65% more likely, or was it just more of like a correlative situation there?
Yeah, I mean, it was kind of looking at it as like a predictive factor. And
got it.
And it's unbelievable to me. And I hope more. We had suspected for quite a while that there might be a link just from what we were seeing, but this was the first article that I had read where they actually were looking at a link between COVID and mental illness, like actual like being diagnosed with COVID, testing positive for the virus, and mental health implications. And post.
Reading that vaccine comment, actually, like it really sprung a light bulb in my head, because even after all the vaccines are out, and let's say that we trump COVID and it gets under control, and the physical part of the pandemic is gone, the triggered mental illness component might not be gone for many people. Of what got started during the pandemic might not just magically go away, or maybe if you're young enough, or it alters belief systems, and you have traumas, you might have ongoing psychological impact from going through this experience.
Yeah, I've said all along in different interviews, like, on the one hand, kids are extremely resilient, right? So they'll recover in one way or another. Like things will get back on track for children who have gone through this. They will, be able to kind of get back to normal once things get back to normal for the most part. However, they are going to remember this time, and they are going to have gaps in their, their socialization, positive reinforcement that they might have ordinarily been able to receive from their environment during these pivotal years, right? And people just missing graduations, missing bar mitzvahs, missing out on just like kind of really important life milestones. It could even be like holidays if they're kind of isolated. But in general, like people will look back and remember like, wow, like a lot was going on during this time. And I felt really low, and I was really isolated, and I couldn't see my friends, and my family was affected. And the moods, just like the whole mood had changed for like 2 years, and so I think it'll be definitely a memory for kids and for adults, all of us, for years to come. And in some ways there might be some micro traumas or even real traumas and or losses or, grief that stay with us forever. But at the same time, I try to be an optimist, and I try to look at more like the resilience research and say, okay, well, most people will be able to bounce back from this in some way, albeit some of those kind of monumental pieces that were missing during the formative years or altered in a negative way.
But on the other hand, there's probably going to be a decent size of people that, you said a big group is going to be resilient and bounce back, but there's some people that might need some support in order to bounce back.
Absolutely. And I think a lot of that is saying, like, okay, well, we're going to have to work with, whether it's our parents or our school counselor or teachers or our private, psychologist to kind of like work through this time and even just going into the winter right now, right, with more people, having to go indoors and missing that social reinforcement even more, the colder months, the shorter days, like all the factors right now are culminating for like the perfect storm of seasonal depression, like exacerbated by COVID, and then also possibly more risky behaviors of like, well, I really do need to see my friends or see somebody, or and then going indoors with people who may not be social distancing or taking the appropriate precautions, which then runs the risk of an additional public health risk into the spring, and the public health risk is now associated with the mental health risk. So there's a lot of things even right now that I think are going to be tough for people in the next couple of months. I think this is going to be the hardest time for us overall in this whole scenario since February, March. And if we get through this, I think there's light at the end of the tunnel. But even right now, I think it's going to be a really, really tough time.
Yeah, absolutely. So I want to give you more than enough time to talk. I know we've been like talking about the foundation, but I want to give you the platform to like tell the world what is this foundation? What are you doing to help access? And then particularly, I know you guys are doing something around COVID relief. So I would love you to hit on that too. So I'll just leave the floor open for you to start letting us know about it.
Sure. Yeah. Well, the Weissman Children's Foundation. Thank you. I appreciate that, Jason. We're a national nonprofit in development, and dedicated to increasing broad-based access to evidence-based psychological and mental health services, specifically for underserved communities of color, underserved children, families, parents, and young adults during the pandemic and beyond. And I'll just mention briefly that we actually started operations in January of this year, right before COVID hit. So we didn't have an intention of necessarily doing this as a result of COVID. We were already trying to tackle the mental health, what we saw as a mental health, public health crisis, again, with regards to equity and access to care. And I was had a lot going on. I just had a new baby and I was running my mission-based, Child Family Institute, which is a very large organization now. And a couple other side initiatives around education and behavioral health. And so it was a tough time to actually do anything expeditiously. I was going to plant some seeds and take my time to maybe think through the next steps for starting a nonprofit, and maybe a couple of years before we approached a corporation or 501c3 or all that kind of stuff. But then COVID hit literally the next month. And I was like, okay, well, I have a new baby at home. This is not ideal, but I really felt compelled to actually do something immediately. And so we launched a COVID mental health relief campaign initiative, a few months later, and I was going to try to do whatever we could possibly do, with the platform we had been developing, even though we're not a full nonprofit yet. So we actually just kind of launched a comprehensive, COVID mental health campaign. And I'll talk a little bit about that now, but I wanted to give you some background there because the events were just the timing of everything was just so interesting. How they happened, and now more than ever, we're really happy we started this and really excited about the next steps. So, essentially just kind of building off what we talked about already in the podcast today. There's this huge gap in mental health access and equity, right? And as far as we can tell, it has not been adequately or systemically addressed by the federal government or insurance companies. So we're attempting to tackle this daunting task, or address this mounting public health crisis privately through a nonprofit, with hopes of contributing through research, education, and advocacy to later policy change. And just to give you an update, currently the Weissman Children's Foundation's COVID mental health relief campaign has raised almost $50,000 through partnerships with Columbia University, our local and state psychological associations, generous COVID relief matching grants, and over 100 private donors. And we've helped nearly 150 families to date in only our first few months. And we have a plan to roll out services to an additional 100 families to start the new year. So that's kind of where we're at with that piece. We're really proud and excited about it. We're also rolling out a few other cool initiatives, including a comprehensive student training initiative, a continuing education program, a grant giving program, as well as a comprehensive equity and effectiveness scientific research council, which we're really excited about, in partnership with a number of internationally renowned clinical psychology researchers and treatment developers to study treatment effectiveness, service delivery and implementation models, and mental health disparities in the communities that we serve. So that's on the horizon, and that it really is going to be an amazing addition as far as, partnering with some of these top folks who are currently developing some of the most innovative psychological treatments that exist, again, in the research laboratories and institutions. And we're going to be able to partner with them to bring those new cutting edge treatments, again, based on cognitive and behavioral science, into our organization, our clinics, and to test not only the efficacy, which is the term that's used in the laboratory, but the effectiveness of these treatments with our real world underserved community populations, and even look at differences across different types of populations, look at equity, look at mental health disparities, and things of that nature. So this is going to be some, in its own right, some cutting edge research, from gathering data on do these treatments actually work in the real world, and with the populations we're trying to help to promote access and equity. So that's really exciting. I will add that for interested listeners who perhaps are as passionate as we are about mental health equity and access, or maybe half as passionate as we are about mental health equity and access, if you do want to learn more, I would really encourage you to consider joining our campaign to help change the mental health landscape and access to care in our country at weissmanchildrensfoundation.org. Or if you'd like to contribute to our current campaign, you can visit our campaign website at iob.org/project/COVID mental health relief, all hyphenated, and I'll spell that again. It's ioby.org/project/COVID mental health relief, all hyphenated. And again, you can find updates about our future campaigns or opt into our mailing list at weissmanchildrensfoundation.org. So there's a little information about what we've been up to. And we love to engage any partners. Again, it's not all about contributions and donations. A lot of this is about just talking about it, talking about the issue, raising awareness, connecting with folks like you, Jason, and putting our heads together on how we can use our resources, combine resources in a fun way to promote these efforts, and just kind of spread the word and continue to engage new folks, new connections, things like that, to actually make a difference on a systemic level.
Yeah, absolutely. And awareness is the first step. If people don't know that there's a problem, they can't ask for change in the problem. So that's fantastic. And all those links the links that you just said, I'll have in the show notes, so anybody could, listening to the podcast, could click into it and be directed directly to the website if they want to collaborate, contribute, or actually give time to the cause. But it's pretty amazing what you're doing here. Like, a lot of people want to make a non-for-profit or have the idea, and you and your organization and people that are passionate about this have been able to get this up and running. But not only are you guys providing the therapy to help people, but you're also doing research to help the field as a whole know how effective the treatment is. And more importantly, is this treatment effective for people that don't have access? Because many times in research, and I might be overspeaking, but the research is done on specific populations, and then it's assumed that this is going to work on different cultures or different populations within the country. And so you're researching this directly so we can answer the question, these people that are not getting services, can this treatment help them?
That's right. And we're probably, I'd like to even look at, mental health disparities in mental health treatment outcomes, right? So using these cutting edge evidence-based treatments, right? Again, we're talking about treatments that have been designed for, one session to treat specific phobias and one elongated session, intensive session, or treating OCD over the course of 1 week with intensive all day exposures, or behavioral parenting strategies that have been shown to, help in a short term with simple token economies. We can talk more about what these terms mean another time, potentially, but to help parents manage behaviors in a systematic, sustainable way over a short period of time, to help with crises during the pandemic, including homeschooling or just getting kids through the day. A lot of these strategies based again on behavioral and cognitive science have now been condensed into shorter formats or more intensive formats, and they're new treatments, essentially new versions of old treatments, repackaged and kind of spruced up in a way to increase perhaps increase the viability and disseminability and also cost effectiveness. And we're going to take these new treatments and we're going to actually see if they work with the real populations that they were perhaps intended for. But those populations, whether it's populations of color, populations of low-income populations, certain communities that probably weren't part of the populations, like you mentioned, being tested in the research institutions where the treatments were being studied, we're now going to see if they actually do work. But also the treatment outcomes. Are the treatment outcomes the same across different populations based on income, ethnicity, race, so on and so forth? And that's what I'm really excited to see. Not only are these treatments efficacious, can they work with all of these controls in a controlled experiment, but are they effective for the people who need it most? And historically haven't had access to it. And so that's kind of, so I appreciate you mentioning that. That's a big part of what we're excited about.
Absolutely. Providing access and proving that the therapy that people aren't getting access to is going to be helpful for them. And basically one thing you're talking about there is having treatment be more effective and more cost effective. Shorter time frame, which costs less, but also the progress happens quicker in a shorter time frame too, which is amazing. And then, I'm assuming I'm tying kind of a bow here that if you get people that are feeling better and you're helping the community, you're getting the research then that also shows that it's being effective and people are getting helped. And then you will have that data and that information to then go to the policy level and say, here, look at what we're doing. If we make this bigger, if we get more support, we could even help even more people.
Yeah, absolutely. And that's the final step. And it's so many steps ahead right now, but it seems like step one is just immediate services, immediate COVID relief. Step two is let's systematize this and collect data, and see if these things work and how they work, and who they work for. And then step three is hey, look, this works. Here's how it works. Here's who it works for. What can we do to make some sustainable changes? And I'll just give you a side anecdote along the lines of kind of, looking at equity and mental health disparities and comparing treatment outcomes and comparing, even mental health issues across different populations, BIPOC populations, et cetera. My wife, Annie, works for the New York City Department of Health. And they're all talking about they're essentially in that one of those early kind of vaccination groups, and she is one of the few white employees in her group, and so a lot of her colleagues of color have talked about getting the vaccine and have been a little bit more skeptical than we've thought to be. And one of the reasons is that they've cited is that a lot of the studies that have been done by Moderna or Pfizer or whatever have been with many white individuals, and it hasn't necessarily been tested as much with individuals of color. And so when thinking about that and dissemination of vaccine, even for COVID from a public health perspective, that's even an issue that people are thinking about. Well, this hasn't been tested for people like me. I don't know how comfortable I am taking it. And so that just shows you, like, obviously in the most immediate crisis in front of us, that this is a concern for dissemination and public health and safety. And it's certainly a huge concern, for getting the most effective mental health treatments out of the laboratory, out of the controlled conditions with only certain populations, and really getting them to the people who need them most, but then seeing if they do work with the people who need them most.
No, absolutely. And I just want to, congratulate you and your team on doing a very beautiful thing and putting so much time and effort, pretty much purely just to help people and to disseminate. So, such altruism, I think, should be congratulated and rewarded where it is.
Thanks, Jason. Yeah. I appreciate that. Thank you, Jason. That's very nice to say. And back at you for Sanity Podcast. This is an amazing dissemination tool as well. And I look forward to many opportunities to partner together and help each other out and spread the word, for years to come. So thank you for everything you do. So now, if you had a simple call to action right now that people want to get involved, because you're at a certain stage, right? We're not at the so at this stage, what are the top 1 to 3 things that people could do to help the foundation? Number one is really awareness building and spreading the word. So I would say that, jump on the links that I mentioned that Jason's going to have on the Sanity website. Take a look, and if you see some, things to share, whether it's, articles or definitely the campaign itself, right? Just sharing on social media, sending it to your friends, whatever you can do, liking us on Facebook or whatever. We have a page for the Weissman Children's Foundation. We have a page for the Child and Family Institute. Following us on Twitter, just getting involved. Like, we just really want to engage people that this is an important issue. A lot of people don't realize what is going on, and that it's not being addressed in any kind of systemic, sustainable way. People would be surprised to learn that. Like, oh yeah, mental health. Yeah, people are probably dealing with that. Well, no, they're really not in an adequate way. So just, getting involved by opening your mind to this conversation and engaging with us in one way or another, and then letting a friend or two know about it. Okay. That's the big one. Obviously, if you can contribute monetarily, that's great, but that is not the number one thing. That's probably like the number 2 thing. So really just spreading the word, engagement, helping us build momentum. And then, also if folks are really passionate about this, like we are, if folks want to reach out and, connect with us directly and want to get involved, perhaps volunteering, perhaps even a board position at some point, those are the stages we're in now, developing the board, developing our volunteer groups, our subcommittees. There's a lot of exciting stuff happening with like leaders, really, really bright thought leaders in all different areas, including we have a really beautiful and kind of brilliant team that has come together to form a DEI committee. And it's very progressive. And I'm learning a lot myself as a white male from that committee. And it's really, going to be interwoven into the foundation of everything we do at the Weissman Children's Foundation. It's all built on DEI.
And can you define DEI for people that don't know?
Oh, DEI, Diversity, Equity, and Inclusion Committee. So we're thinking about all of those issues that can impact the way we build out a foundation around those issues. Because a lot of nonprofits that have had, especially folks, foundations that have leaders who are white males like myself, not a minority, so to speak, have been well intended, but have not set things up in a all encompassing, sustainable way to tackle the most important issues, to connect with and meet the needs of the communities we're actually trying to help. Mm-hmm. And it's one of those things where it's not just like if you build it, they will come. It's like you can build it, they may never know about it, or even if they know about it, they may not come, or you may not be able to even reach them. So we want to really think about issues of DEI, bring in members from the communities we're trying to connect with, and build partnerships, including our Columbia University partnership serving the Harlem community, where we're training the students there in evidence-based treatments and state-of-the-art CBT, and then they're servicing the Harlem community. That's one way. It's one partnership model that we're able to kind of reach one of the communities we're trying to serve. But how do we do that on a more systemic level? And a lot of times that's bringing in volunteers, board members of color from the communities we're trying to partner with and trying to help. And a lot of other organizations have tried and fallen short because they haven't thought about the DEI issues from the ground up. And that's something that's very important to us. So we have a lot of different committees. DEI is one, but also communications, marketing, fundraising, operations, finance, so on and so forth. So anyone interested in getting involved in that level, helping us further this mission, or even as a partner, like a Jason with the podcast, audience and platform, or, other folks who have connections, whether it be politically or high profile individuals, or, folks who can partner in one way or another. Mm-hmm. We're open to all ideas. We're even talking to Black Lives Matter and a few other organizations that potentially, see how we can build more partnerships with like-minded folks to really try to help solve this problem of broad-based mental health access and equity in the country.
Okay. So even if you're not a mental health professional and you think that the Weissman Children Foundation could be helping your community or your organization, it sounds like you have open arms for people to reach out, and you could see if there's any collaboration of help that you guys could be.
So many ways to get involved. Absolutely.
Okay. And if people have a specialty like marketing or communications, it doesn't have to be therapy based. As long as it's something that helps the foundation's mission, people could help volunteer to help bring better mental health access to communities that need it.
Exactly. Yeah.
Fantastic.
Open arms.
Well, any last comments about the foundation or about access before we wrap up?
No, I'll just thank you, Jason, again, for having me on and for doing this. And again, being kind of like a beacon for dissemination and trying to get the word out about all the great speakers you've had on and their areas of research and therapy but this broader mission as well. You've been so attuned to it from the beginning. Our conversations have always been really, interesting and like-minded. And so I really appreciate you having me on. And I just want to say, to you and your family and to everyone listening, wishing you guys a very happy and healthy 2021.
Yep, absolutely. And thanks for coming on the show.
All right. Take care, Jason.